Hello everybody. Thank you very much for joining us. Welcome to the UCD School of Medicine Radiography and Diagnostic Imaging webinar, which is part of UCD's Masters Week. This session is tailored to give you insight into the graduate taught courses offerings in UCD School of Medicine in Radiography and Diagnostic Imaging. And we offer an extensive portfolio of graduate taught programs across all modern imaging modalities. We have a great lineup of speakers eager to present to you, starting with Dr. Shane Foley, who will give an overview of radiography and diagnostic imaging. Then Ms. Adele Thomas, who will cover the Masters in Computed Tomography, followed by Dr. Alison McGee, who will present on a Masters in Magnetic Resonance Imaging. Dr. Kevin Cronin will then present on Master in Ultrasound, and that will be followed by Mr. Jack Potnick, who will cover Masters in Medical Imaging. And then at the end, we will have a Q&A session. So before we get started, I just want to tell you that in order to get the most out of this webinar, we're happy to answer questions as we go along in the questions and answers section. So please feel free to post them in the Q&A section at the bottom of your screens. There will also be time for a Q&A session at the end. And if you think of any questions afterwards, you are welcome to email us at graduate.imaging@ucd.ie, which I will put in the chat function later. In case of any latecomers, for those of you who have just joined, welcome to the UCD School of Medicine Radiography and Diagnostic Imaging webinar, which is part of UCD's Masters Week. So without further delay, I will hand you over to our first speaker, Dr. Shane Foley. Thank you, Shane.
Excellent. Thank you, Jean. And thanks for doing all the work for me there with all those introductions. So save me a few minutes. But good evening, everyone. You're more than welcome. And as Jean said, this is very much just an overview of some of the master's programs that we offer here in UCD from the Radiography and Diagnostic Imaging section. So the plan for tonight is really just to take you through very briefly through each of those, and also to give you a chance to ask us any questions. So of course, as Jean said, please add those to the chat, or just put up your hand or let us know as we go, and we'll be happy to answer them. Although tonight we are focusing on some of our more popular master's programs, they're not the only programs we have here in from the Radiography and Diagnostic Imaging section. And of course, our website has all the details of further offerings. So I would just remind you of that as well. And my job here tonight is really only very much introductions as to where we sit. And just to let you know, so radiography and diagnostic imaging sits within the School of Medicine, which is one of the 5 schools within the College of Health and Agricultural Science. So we're quite lucky to be situated in a relatively new building, which you can see on screen here, which is our UCD Health Sciences building, which caters for our students across many programs. And radiography is only one of those. We also are in the same building with medicine, nursing, physiotherapy, biomedical life sciences, and many, many more. And it's quite lucky, and we're fortunate in that aspect that we share many resources, not just the teaching and learning facilities, but also the anatomy labs, computer labs, and obviously all the expert academics that are located as well and are based within the building. So it really is an area for interdisciplinary education as well as research and no doubt social interaction. I did mention that all our programs are available for you to review under the UCD website. So you can simply search for UCD Radiography and you can see some of the graduate offerings. I'm here just literally giving a quick illustration of what it looks like, and you can literally just click on any of the tiles to navigate. There are a range of graduate opportunities across the School of Medicine. There's probably over 40 different offerings, but the radiography programs are one of those sections. So you can just literally click on any of those links and hopefully bring you to the relevant teams. And that's where we come to the tonight's offerings, where we're going to focus on our primary and most popular master's programs. Many of which are just shown here on screen, but also we have our MSc in Medical Imaging as well, which Yaka is going to present you on. So without further ado, we're going to hand over to Ms. Adele Thomas, our Director of our Masters in Computed Tomography. and Ida's going to give you a shorter overview on that. Thanks,
Oh,
Ida.
thanks. Thank you very much, Shane. And hello, everyone. You're very welcome here this evening. So I'm just going to give you a quick overview of the MSc in CT program and also the graduate diploma in CT program. So we have two graduate programs, but one leads into the other. And tonight I know we're focusing on the MSc CT program. So this just provides you sort of with an overview of the plan in terms of the different modules and when they occur in each trimester for our program. So really the CT program provides graduate education to support CT radiographers in their professional role. So it is there to provide additional education over and above that which the radiographers would get in their clinical practice. So it's really to give them that solid foundation and to advance their clinical skills and that they're already learning in their clinical department. So it does also support the development of those specialist level clinical skills in students as well, for when they're working in their busy CT department. So in addition to sort of getting lectures, the students will also do clinical practice, and that will provide that foundation for them to develop those skills then as they go on through the program. So you can see that we have a graduate diploma there and an MSc CT, and the graduate diploma and the MSc CT both start off with 4 modules. The students do the same 4 modules. So in the first year, in the autumn trimester, the students will study technology of CT1 and professional practice of CT1. And in terms of the types of topics that the students might do in the professional practice modules, students would study things like clinical applications. They would focus on things like neuro CT, body CT, CT angiography, musculoskeletal CT. So all of those different areas, and really looking at the clinical indications, the practical application as well of how to do CT scans and how to look at the images and what might be present on them and how to problem solve. So really the learning on the professional practice of CT modules does help the student develop their clinical reasoning skills and their skills to sort of make decisions based on what they are seeing on the images as to how to proceed next. So in the spring trimester, then you can also see the students would study another professional practice of CT module and a technology of CT module as well. Now, the technology of CT modules, each of them are worth 10 credits, as you can see there, and they really focus on things like the physical theories and the principles that underpin and underlie the technology that is used in CT. And it really explores the various sort of themes relating to things like scanner hardware, software, quality assurance, image quality, radiation dose, alternative uses of CT technology as well, and facility management. So everything really in those 4 modules really will provide a solid foundation in terms of practice and a sure foundation of education for the CT radiographer as well. You can see as well there that in year 2, in the autumn trimester, there is a final advanced CT imaging module worth 30 credits. So this is the only module undertaken by students who are doing the MSc CT, and they would explore on that module more advanced applications and sort of new and current emerging technologies that are coming out in the field of CT. And they also undertake a small bit of clinical research as well, and they would develop those skills as they are going through the program, but especially consolidate them in that final trimester in year 2, as we can see there. So that is really just an overview of those modules that we have on the CT program, and they do provide all those essential skills that are needed for working in that busy environment. So in CT, in the programs in CT, some of the unique selling points of this program are that we have a blended learning and a flexible delivery in terms of content. So what this means is that sometimes we face-to-face lectures, group discussions, tutorials, but there's also e-learning and there's online materials the students will interact with as well. And this provides just a much more flexible approach as it enhances overall student learning. And students would generally be in up in UCD doing CT lectures for 3 days, and then with the 4th day they do online learning and e-learning, and that would be how we run each lecture block. Students also will get a hands-on image processing opportunity when they're up in CT. We've got computer labs in CT, and it's possible to book those and to look through cases and images and to perform basic image processing on those data sets as well. And I think this provides students with a real sort of practical opportunity to view their scans and any types of data set that we have from multiple different sort of perspectives, and in terms of looking at them and asking questions about pathology and image quality. And this is all fed back in a classroom session where we all discuss everything together. So it gives the students that sort of time to do that when they're in UCD, and they won't always get the time to do that sometimes in clinical. So we're professionally accredited by the IIRT as well. So we have that as part of the course. Why would you want to take this course? Well, there's a lot of opportunity for peer dialogue, and so students meeting in UCD really have that opportunity to chat together and to explore different ways of doing things and to see what other people do in other departments or with different scanners, or indeed people who have the same scanner as in their department but may be doing different things or having a different approach. So it really facilitates that. Some of our classes are discussion classes, but even outside of the classroom, it gives a really good chance for students to meet up and to form a group with their own peers who are at that level, and they can support each other as they're going through their study. And that a lot of students get a really good value out of that, and they really appreciate coming up to UCD and meeting other CT radiographers who are at the same level as them. We also would, in the advanced CT imaging module, we would discuss advanced knowledge of CT optimization and quality assurance and radiation dose. So students are exposed to the latest developments in technology, as I've already said, but really just to delve deep into that and how they work as well, which they don't always have in their own hospital if they're not working with the latest equipment at the time. And students also have that chance to research new technologies and to develop clinical reasoning skills and image appraisal skills. And again, this just really helps them build their foundation of knowledge in terms of decision making, and in terms of like, why would I repeat something, or what would I do next, or would I need to do another scan phase, for example. But also in terms of checking images and seeing, have I got everything that I need on the image? Is there any pathology on the image? Which sort of closes the loop for students and for CT radiographers in terms of their tasks that they are doing with each patient that they are scanning as well. So students would also do anatomy and pathology as part of their modules. And so do I need a clinical placement to undertake the program? Yes, students will need to be in clinical placement in CT for the duration of their program. So whether that's the graduate diploma or the master's in CT. And they have their own clinical supervisor when they are in that placement, who will guide them in clinical in terms of what they are meant to be reviewing that trimester and supporting them in terms of answering any questions they may have about CT practice at that stage. And it is important as well that our students have a baseline of CT knowledge prior to beginning the program, and therefore students would also need to come in with at least 3 to 6 months experience in CT prior to starting the program, and that just provides a really good foundation for the whole class to begin. We do begin at the very beginning in terms of CT in their first module anyway, but just even in terms of familiarizing themselves with the technology, with the terminology, and with CT practice, that is very important. So I'd be happy to answer any questions if anybody has any later on. Thank you, Shane.
Great, thanks, Adele. And as well as the website, what you'll see is a recurring email address here for any queries. So you can see it on screen at the moment, graduate.imaging@ucd.ie. So should you have any questions, even after the event today, please feel free to use that email address with any queries you might have. We're going to move on swiftly onto our next presentation, and that's from Dr. Alison McGee, who's our program director for the MRI Masters. So over to you, Alison.
Thank you, Shane. Welcome everybody to our webinar series this evening. I'm going to talk to you about our graduate diploma and MSc MRI programs here at the UCD School of Medicine. So these programs aim to provide radiographers with a high quality learning experience that aims to integrate the theories, the physical principles with the practical application issues as they relate to MRI. So it thereby helps to support students in their pursuit of academic mastery, in their enhancement of clinical competence, and also in the advancement of their own professional development. The two programs run seamlessly from the 12-month graduate diploma program to the 16-month MSc MRI program. And if you would mind advancing the slide, Shane, they are divided into discrete modules of study, as you can see here. So during the first two trimesters, the autumn and spring trimesters, students study technology and practice modules related to MRI. They have an opportunity to consolidate the application of that knowledge based on clinical scanning during the summer trimester. And those students who wish to undertake the MSc program return then for a fourth and final trimester of study, during which they explore advanced MR imaging technology and applications. So during both programs, student learning across these modules is achieved in various ways through their contributions during in-class discussions, to their contributions during tutorials, their engagement with formative online quizzes, reflections on clinical practice, practical scanning skills, as well as the various written and oral assignments and examinations that they complete as part of the modules. Clinical learning is integral to both programs, and again, this helps to consolidate this theory-practice link, helping students to enhance their clinical competence. Typically, students undertaking the MSc MRI program are required to complete a minimum of 900 clinical placement hours over the duration of the program. So in terms of the module content, then you'll see that the two technology modules sort of lead from one to the other. The first module begins at the beginning in terms of addressing the underlying physical principles associated with MR signal generation, the component parts of the scanner, their functional options, some basic level pulse sequences and aspects of tissue relaxation and MR image appearances, understanding image weighting and contrast characteristics, an introduction to artifacts and basic safety. So this sets the scene to link with the practice of MRI module taught during that first trimester also, which addresses neuro, brain, spine, ENT, and musculoskeletal imaging. The second technology module then further sort of builds on the material addressed during the first module. We look at more advanced pulse sequences, mainly designed for fast body imaging and vascular imaging. We explore in more detail different functional options of scanners that are built into pulse sequences for various clinical applications. And we also explore in more detail artifacts, facility design, facility management, and aspects of MRI safety. In tandem with that second technology module, students study a practice of MRI2 module, which again focuses on body imaging, abdomen, pelvis, vascular imaging, so the fast imaging techniques. During the practice of MRI modules, the students will address MR image appearances, the scanning protocols and the justification for that. And they also explore the MR appearances of both normal anatomy and pathology. So during the summer trimester, the modules, the 2 clinical practice modules, are essentially student directed with support from the teaching team here at UCD, where students have the opportunity to apply the knowledge that they have gained in the previous 2 trimesters to their actual MR scanning practice, and to reflect on aspects of that and demonstrate competency, their ability to run an MR scanning session and justify and make decision making appropriate to their professional practice. The final advanced MR imaging module undertaken by the MSc MRI students then is an opportunity for students to evaluate some of the advanced applications within MRI. So cardiac, advanced neuro, breast MRI. Also, the students undertake an audit project, so they have an opportunity to undertake some applied research that is pertinent to their imaging department and might have the opportunity then to change and influence practices within their department. So this is the opportunity that students have to bring back to their department aspects of what they've learned to enhance the patient experience and the professional role of MR radiographers in their department. So then thinking about the selling points of the program, so it provides a framework to essentially integrate theory and practice. We believe that it's important that students are not just learning the physics for the sake of it, that they understand its application to the equipment that they're utilizing, the challenges and the limitations associated with that, and that this also influences their decision making and how they can approach the scanning of different patients, different examination types that they meet on a day-to-day basis. The program has a blended learning approach that integrates lectures, MR image-based and technology tutorials, self-directed student learning, practical scanning skills. So there was something to appeal to students with different sort of learning preferences. It also supports working radiographers through its flexible program of delivery that incorporates online and face-to-face teaching and learning sessions. So why would you take the course then? It confers clinical competence, and it means that our students can apply the knowledge that they're gaining to their professional practice to enhance that professional practice, and also to apply the critical thinking skills that they learn on the course to improving the patient experience and their own professional experience and development within their imaging departments. It also provides students with the skill set to enable them to take on more responsibilities and more senior roles within their professional work practice. And many of our graduates go on to take on such senior roles. So in terms of some commonly asked questions, so do I need to have clinical experience? Yes. We normally look for, on average, about 4 months of clinical experience, and we find that this is necessary to help students come to grips with the in-depth technology and practice information that they are learning, that they have some sort of context for that learning at the start of the course. But every application is viewed on its own merits. Do I need to be working in an MRI department that undertakes all MR examinations that we will study during the course? And the answer is not necessarily no. Okay, so again, not every MRI department undertakes the full range of potential MRI examination types. Sometimes students may be able to organize a visit to another hospital site that undertakes examinations, but this is not compulsory, and we can provide assistance and guidance on this to students if they wish. So this is the overview of the program, and I hope that it sounds interesting to you for those of you who might be interested in studying MRI here at UCD. So thank you.
Super. Thank you, Alison. No questions so far coming in through the chat, but again, just a reminder, if you do have anything, just please stick it in, and we'll try and answer them all at the end of the presentations. So we keep moving, and we're going to go on to Dr. Kevin Cronin's presentation next, which is going to cover the Masters in Ultrasound program.
Thanks, Shane. Good evening, everyone. To introduce myself, my name is Kevin Cronin, and I will give you a brief overview of the Masters in Ultrasound. Perfect. So the course overview, the program itself is 16 months in duration across 3 semesters. And on completion of the program, it confers clinical competency in ultrasound. Unique selling points of this program is it is taught by highly skilled and competent lecturers who are all clinically active, working in the clinical environment. Excellent feedback from current and past students, and currently ultrasound graduates are in a high demand globally. So why would you take such a program in ultrasound? Well, we focus a lot on the practical aspects of ultrasound. We apply a lot of theory at the beginning of our lectures, followed by a practical demonstration. We have a high range of supportive staff, both within UCD, but we also have a lot of guest lecturers who are specialists in their areas, such as pediatric sonographers or sonographers in more advanced roles. We have a range of assessment methods that are used to suit all learners. So it's not typically just one type of assessment structure. Sorry, just struggling to move that on. Okay, so this is an overall structure of the ultrasound program here in University College Dublin. And what you can see is that there are 2 streams. If we focus first on the one on the left-hand side, we call this the general stream. So this is a stream broken down into 3 semesters, 1, 2, and 3. In the first semester, all students will undertake a technology of ultrasound 1 and abdominal ultrasound 1, and then they will also choose between vascular ultrasound or superficial structures. So technology of ultrasound 1 focuses on the basic technology of ultrasound, the physics of ultrasound, the knobology of ultrasound. Abdominal ultrasound 1 is primarily focused on the hepatobiliary system, so focusing on the liver, the gallbladder, and some of the structures in and around there. And also students, they need to focus on vascular ultrasound or superficial structures. And this is where students have the option to choose based on their clinical environment. So vascular ultrasound 1 would be more suited to students where they would undertake a lot of arterial ultrasound or venous ultrasound, such as carotid ultrasound or deep vein thrombosis, whereas some clinical environments might focus on superficial structures such as scrotal ultrasound or thyroid ultrasound. Semester 2 is where all students undertake technology of ultrasound 2, abdominal ultrasound 2, and this is where there is an additional module of gynae ultrasound 1. Again, the students will, if they chose vascular ultrasound 1, they will choose vascular ultrasound 2, or if they chose superficial structures 1 initially, they will choose superficial structures 2. So these modules are just advancements on the previous modules themselves, looking at more detailed anatomical landmarks themselves. But this time we have gynae ultrasound 1. So this is where we introduce the basic ultrasound assessment of the male and female pelvis, and it must be made aware that if you do undertake a master's in ultrasound, you must have access to transvaginal pelvic ultrasound examination. The final semester itself looks at abdominal ultrasound 3, gynae ultrasound 2, again vascular 3 or superficial structures 3, but we also add in a management module where we look at particular areas such as audit management within the ultrasound department and more advanced roles that we see currently in the clinical environment, such as the reporting sonographer itself. So that's the general stream. The other option to do would be to do the obstetric stream. So the obstetric stream follows a similar format as the general stream itself. However, this is mostly suited to those who are undertaking obstetric ultrasound in their clinical environment. So you really choose the context which suits your clinical environment itself. So how will you learn if you undertake the Masters in Ultrasound? Well, there's a series of areas how we teach on this program itself. We undertake formal lectures, which is the majority of the lectures are on campus here in the School of Medicine in UCD. We do offer some online live delivery of ultrasound lectures themselves with some pre-recordings as well. We have a lot of image-based sessions where we review ultrasound images and have case discussions with them, where we place a big emphasis on reviewing a series of images with the ability to report at the end of it. We offer some problem-based learning. Most recently, we've been doing a lot of practical sessions. So that's where we would have a skills-based session where we sonographically assess a particular anatomical landmark with an ultrasound scanner to put the theory into practice. We have a scan trainer on site here in campus to help you with your transvaginal pelvic ultrasound examinations in the clinical environment. We have discussion threads, in-class quizzes, online information, and we also have a electronic portfolio that tracks your clinical placement. So how will you be assessed? There are many different modes of assessment that we employ on the Master's Ultrasound program, such as image-based assessments, the OSCE types, where you're given a series of images and you have to formulate an answer at the end of it. We typically structure this in the same format as when you're reporting on your own ultrasound examinations, where you have to draft a report at the end of it. We evaluate the competence and the clinical skills with the final practical assessment, the summative assessment at the end of the third semester. We have some essays, case presentations, oral case presentations. We have the clinical logbook, and we have formative assessments throughout the course of your program, just to monitor your overall progress. And just to conclude, we do not arrange the clinical placement for the students themselves. If you are to undertake this program itself, the student must arrange the clinical placement themselves. They must also have an approved clinical supervisor in place, and again, access to the suitable imaging application systems that has a RIS-PACS system and the appropriate referrals coming in. So if you have any questions, I'm more than happy to answer them at the end, or you can email graduate.imaging@ucd.ie.
Great, thank you, Kevin. And next up is Mr. Jaka Potoknik, who's going to give an overview on the MSc in medical imaging.
Okay, hi everyone. My name is Jaka, and I'm looking after the Masters in Medical Imaging program. So the program is offered on both a full-time and part-time basis, and the application deadline for the full-time and part-time September intake is August each year, and the application deadline for the part-time January intake is early December each year. So the unique characteristic of the Masters in Medical Imaging is that students can tailor their academic pathway based on their research interests, professional needs, and of course, personal goals. Upon successful application, students are provided with a list of suitable modules and indicate which ones they would like to complete. Of course, throughout the whole process, throughout the application process, we are in touch with you on an individual basis. There is regular communication to ensure that the proposed pathway fits your interests, fits your needs, and your goals. Modules related to other disciplines such as AI, informatics, entrepreneurship and innovation, management, and more are also available to you. So you are not limited to only radiography-related modules. You can consider other modules from other disciplines as well. Certain modules are delivered online, while others require face-to-face attendance. And one thing that you should note is that a fully online pathway is not suitable. It is not feasible, okay? So at some stage, you will be expected to attend the campus. And the goal is to equip you with the skills and knowledge necessary to undertake a research project. And later, next slide, please. Drive improvements in diagnostic imaging, patient care, and/or engage in industry-related activities. And the theoretical knowledge and research skills you gain throughout the program are valued by clinical and industrial employers. So a couple of things you should note in terms of requirements. You should submit a complete application, okay? So to date, we have received quite a few incomplete applications, and any incomplete applications are disregarded. They are not reviewed, okay? So make sure that you visit the program's website, have a look at the documents and templates that you need to consider and include in your application, okay? You need to include a pre-course form whereby you indicate your interests, your goals, explain why would you like to undertake the program and what do you hope to achieve. Those considering full-time studies should also attach a draft research proposal. So as you know, the program is only 12 to 16 months. This goes for the full-time offering, meaning that students are expected to work consistently on their research project throughout each trimester, which is why it is super important that you have a well-defined research topic from the very beginning of your studies. International students interested in the program are required to provide evidence of English language proficiency. And then some other things that you should be aware of are that, as I mentioned before, a fully online pathway is not suitable, okay, it's not feasible for this program, and that there are no clinical placements, okay, associated with the program. So this is one of the most frequently asked questions, whether there are any clinical placements and if students or candidates can become radiographers upon completing the master's in medical imaging. And the answer is no. There are no clinical placements associated with the program, and no, this program is not designed to train you to become a radiographer, okay? So if you hold a level 7 degree and you'd like to become a radiographer, you should really consider our graduate entry radiography program, okay? And don't underestimate research or your master's thesis dissertation. What many students do, they focus on completing their modules, theory-based modules, and they kind of neglect their research activity, and they leave their research project, any kind of research-related work, till the very end. And this often results in delayed graduation, okay? And if there are any questions, please email us. You can email me directly or the graduate.imaging@ucd.ie. Thank you.
Super, thanks, Jekka. Bang on time, everyone. So we do have time now for questions, which is exactly the purpose of this evening's session. And just note, and Jekka has just touched on it, there's been a number of questions in about are these programs open to non-radiographers, I guess, or are they aimed specifically at radiographers? So just to be clear, all these programs are essentially specializations in that people who already have a radiography qualification, so as to become further specialists in the area. Jekka, can I ask, have you ever had applicants from outside radiography on the MSc in medical imaging?
Not me personally, but the previous director, I think they had a student who was working with ionizing radiation. They were not a radiographer. I'm not exactly sure where did they work and what did they do at work, but what was their trade, but they were working with sources of ionizing radiation. And so for all professionals who are working with the sources of ionizing radiation or are utilizing not diagnostic imaging, but are working perhaps with medical devices or anything similar or like, then the course might be suitable for them. And again, which is why it is important that you indicate to us why would you like to pursue the Masters in Medical Imaging? What is your goal? What do you hope to achieve by the end? And we can determine whether the program is suitable for you or not.
Thanks, Jacka. Because indeed, the Masters in MRI, Ultrasound, and CT all effectively confer a type of clinical competency to be able to use those scanning, or to be scanning in hospitals typically. In Ireland, that requires you to be so have completed a CORU approved program of education to be able to work as a independent healthcare professional.
And just to jump in on that,
yeah.
Sorry, Shane, just to jump in on that, for the Masters in Ultrasound, we would have prospective students coming from midwifery, and also maybe in medical doctors as well who work in obstetrics, but they must be registered to their professional body.
Yeah, exactly. I think I put that in the chat message to when that question is posed. So the ultrasound program does take radiographers or other healthcare professionals who use ultrasound in their clinical roles. Yeah, indeed. Yeah. But I guess the medical imaging program is a bit more flexible because it doesn't have a clinical placement attached or require clinical competency. It allows people to come in with an interest in a variety of areas to pick and choose, I guess, for their skills. Any other questions? Anyone attending? No? Well, if not, I just want to thank all our speakers tonight for giving you that kind of short and hopefully sweet overview of our programs. Just to be clear, again, more information, more in-depth information is certainly included on our website, and I'd encourage you to go there to review the most up-to-date information on our application system, but also on our program content and the various modules that you can undertake. And as you've seen across the presentations, if you do have any queries or you want further information, please do reach out by email to our graduate.imaging@ucd.e email address, and we'd be delighted to help you further and hopefully clarify anything else for you. So thanks again for attending, and good luck with your future studies.